Welcome, welcome for those of you who are joining. Hello, hi, welcome, welcome. If you don't mind giving me a little thumbs up if you can hear and see me okay. A little thumbs up and see how you're doing. Feel free to put in the chat too where you might be joining from. I'm in New York City right now. It is not as bad as it was before. The snow has lightened up a little bit. Thank you so much, Mark. Thank you. We're actually going to start right away. We have about 26 or 30-ish registrants today, as is often the case. Not everybody comes in live. A lot of them wait for the recording after the fact. So because I have something right after this webinar, I'm going to kick it off right now. So bear with me a sec as I get my slides in order. And let me just make sure I can see, there we go. I can see it in front of me. All right, so welcome everybody. This month is February. It is Heart Health Awareness Month, and we are going to be talking specifically about cholesterol and the role it plays in our bodies and how it's related to heart health. Just some things before we officially begin the presentation. The session is recorded, as I'm sure you heard when you were coming in. You can use the chat box at any time. I'm flying solo back here, but I'll do my best to keep an eye on any questions that might come up. But we will also have a formal Q&A at the end of the presentation in case you want to hold your questions until then. You're taking notes along the way. As I always say, I'm a dietitian, not your dietitian. Please make sure that you adhere to or contact someone else who is in your healthcare professional team. What I'm sharing with you today is informational and educational, not meant as medical advice, just to give you a little bit more of an awareness as to what you might need to look out for and questions that you can bring with you when you go see your own primary care providers or other healthcare professionals. Be sure that you also get medical clearance before you're engaging in anything, whether it's food and nutrition related, medicines that you're stopping and starting, physical activity, etc. Make sure that you're cleared by your doctor before you change up anything that might affect your overall physical and mental health. As you may be aware, when you registered, you are going to be part of our email distribution list. So that means from this point forward, we'll send you usually about a monthly protocol that I have these newsletters that go out. If at any time you feel like it's too much, you can always opt out of being on our mailing list. But we will follow up with a recording link of this presentation, and we'll also share with you a survey link as well. It's about 5 minutes or so of your time. If you can, when you receive it, just get on there and share a little bit about what you thought about today's discussion, what you learned, what you liked, what you think could be improved. And then you also have the opportunity to share any interest in any other topics that might come up that we might be able to include in future webinars. So for those of you who do not know me, hello, my name is Dina D'Alessandro. I am a registered dietitian, nutritionist, an RD or an RDN as we are called. I'm also an adjunct professor of undergraduate and graduate nutrition studies here in New York City, up in the Bronx at a city university school called Lehman College. I'm also the campus nutritionist there as well. I work in the student health center, usually 1 day a week every semester, where I meet with the student population who come to see me for nutrition counseling. I'm also the founder of the virtual space, the virtual platform called Dish with Dina, where I do a variety of things like this. I'm also trained in diabetes prevention and education through the CDC's National Diabetes Prevention Type 2, Prevent Type 2 lifestyle approach. So it's a curriculum that is given out by the CDC, and I'm trained to help people with that. So that's also something that I include as one of the many conditions that I am able to work with in my private practice, because I also run a very part-time private practice where I work with a variety of individuals, usually in varying ages and stages of life. I do take some health insurance as well, so that's always helpful if you can get your nutrition sessions covered by health insurance. And if you are interested in that, I can share with you more after the fact how to reach out to me to book a session. I also have some really cool things that I do, that are part of like my expertise, like being involved in research studies and also having people from larger periodicals and websites and news organizations that sometimes will ask me for quotes in things. So that's always kind of cool to see. And then I'm also doing speaking engagements, presentations, and panel discussions that I get either hired to do or asked to do with a variety of different places too, like women's conferences, nutrition seminars, etc. I'm also really, one of the things that are nearest dearest to my heart is I work with so many nutrition students and dietetic interns, and also newly credentialed dietitians. I help mentor and precept them in their internships so that I can kind of see them become my future colleague. I'm going to take a sip here because I've been talking all day. So bear with me one sec. That could also be your hint to take a sip of water yourself. All right, so let's begin. When we hear this word cholesterol, I think a lot of people are not entirely 100% sure of what we're talking about. So this is a substance that exists in our body. It's naturally occurring, and it's like a waxy fat, what's called a fat or a lipid substance. So a waxy substance that occurs in our body. It is known as a non-essential nutrient. I'll explain a little bit more about that in a second, which basically means the definition of that means that our bodies do not require to get this from outside food sources. Our body actually makes or synthesizes cholesterol in the liver. So the things that I'm going to share with you coming up will tie into why that might be important. And it is found in animal foods. So anything that is a human living animal organism is going to contain cholesterol. The function of cholesterol in our body is it helps with creating cells, it helps our body function on many different levels. It helps with building certain hormones. It helps with vitamin D process as well. We have what are known, I'm going to get a little sciencey for a sec, but I think a lot of you already familiar with these words that I'm going to share with you, or at least the abbreviations, the acronyms of these words. So we have what are known as lipoproteins or lipoproteins. So that comes from a combination of lipids, fat, and proteins, and this is like a molecule that is formed in our body, and it helps transport the cholesterol in our body into different places. LDLs, which if you hear of good and bad cholesterol, this is the quote unquote bad cholesterol. I try to think of it as L as in lousy. So the LDL transports cholesterol to the body, where the high density lipoproteins, the HDL, the good cholesterol, or H as in happy, I like to say that too, the HDL transports the cholesterol away from our body, meaning that there is a distribution of where that cholesterol is going. It's not going back into our liver, or it's not going back into different parts and kind of like accumulating in that case. And you'll see in a bit why that might be important as far as heart-related conditions are concerned. So on that bottom bullet that you see there, the high LDL and low HDL, when you have this ratio, so if I'll talk a little bit in a moment about blood tests, like when you go to a doctor and when you're looking at your cholesterol test, your cholesterol blood test, what you're keeping an eye out for. When you have very high amounts of that LDL, that lousy or bad cholesterol, and very low amounts of the HDL, that high density lipoprotein, the happy stuff, the good cholesterol, it ends up malfunctioning in a way. It ends up with a poor removal of whatever is considered SX cholesterol in our body. And then, as you'll come to see, that builds up and can cause blockages and put us more at risk for heart conditions, heart disease. So when you look at stuff as a whole, right, cholesterol is like the family of things that you're looking at. And then there's all these little other components. So total cholesterol is a little bit different than this high density to low density. That is really what you're taking a look at and being a little bit more mindful of the ratio of that. So I wouldn't stress too much or be too frustrated if you feel like the number that you're going to see in the cholesterol blood panel or blood test comes back a little bit high. Take a look more if your doctor can share with you more insight as to the individual components of what that really means, what is putting you more at risk. So, what ends up happening in the relationship of cholesterol and heart health, I mentioned before, right? Your liver is already making the cholesterol. If you are eating foods that are high in what is known as either trans fat or saturated fat, that's the stuff that could be solid at room temperature. It could accumulate and add up, and then, of course, create blockages in your blood vessels and cause issues for heart disease to happen. It makes that cholesterol level, that normal cholesterol level that you have going on, increasing to an unhealthy level. So the words here that are affiliated with that, if you happen to be diagnosed with this condition, you might see something called hyperlipidemia. So hyper meaning elevated or higher than normal levels. Lipids, right? Lipids I mentioned earlier is also the same name as saying fat. So it's a different name for the word fat. Anytime you see emia at the end of a diagnosis or a condition, it means that it is in the blood system. Whereas urea, URIA, would mean something that's found in your urine stream or your urine test. So hyperlipidemia means that you have high levels of fat in your blood. Similarly, you might also see hypercholesteremia. Actually, I think I might have spelled that wrong. I think it's longer than that. I think it's hyper elevated cholesterolemia, if I'm not mistaken. So I think I might have made a mistake on that. But the point remains that it's high levels of fat or high levels of cholesterol in your blood. We don't want that. We want all that kind of flushing out and being utilized in different ways and functions in our body. Other issues, so aside from what I just said before, your body's already producing it. You might be eating food that's high in cholesterol or high in saturated fats. Other risk factors, as we age, it's just the consequence of getting older. While it's a big privilege to be able to get older, these are also potential risk factors of elevated cholesterol levels. You never know what's going on, your wear and tear, your inability to process certain things, and or whatever factors are happening. Specifically with medications, there might be some medications that you're taking that could disrupt that pathway that naturally happens for us to be able to monitor and manage our cholesterol levels in our body. And then on the right-hand side, we have smoke and sleep and stress. So if you are a current smoker, I always recommend knocking off that habit. I know it's hard, but it's definitely putting you at much more higher risk for so many other things, including things like heart conditions, heart disease. Sleep plays a huge role too, because all of this in our body is really reliant on hormones. And we just mentioned earlier that cholesterol plays a role with hormone synthesis and helping us with making and moving things around in that way. So hormones are helping us make our body function. When you have erratic sleep, whether you have poor quality or quantity sleep, that can affect and become a hormone disruptor. And then stress levels. So we talk about this more often when we talk about things like high blood pressure, but really stress can offset our normal way of functioning too. And then everything plays a role and your heart ends up suffering the consequences there. So finding ways to manage stress is always, very important. I know sometimes it's a little bit easier said than done with self-care or having some boundaries in place, but I very much encourage, think about some of the conditions that are going on in your life right now and how you might be able to monitor or modify some of those things. All right, let's talk about some of the more common conditions that come up when we have discussions around cholesterol specifically, the hormone discussion I mentioned too, that's related in there, and heart-related conditions. So we have coronary heart disease, that's kind of the umbrella term for any kind of issue with your heart. Stroke, which can be when a blockage happens and it releases itself and it causes a disruption and it causes an issue with your brain. So again, this could be something that you do not recover from, or you end up with some impairments after the fact. Peripheral vascular disease. So when we talk about the periphery of things, we're talking about the things that are in your extremities, like your fingers, your toes, etc. So vascular, meaning the blood system. So again, the consequences there that it might affect the different parts of your limbs, fingers, toes, legs, etc. There's also a type 2 diabetes discussion in that as well. Again, things that are not managed properly or they're having poor control over can interact and interrelate with other conditions as well. So type 2 diabetes, while people might think, oh, that's like a blood sugar discussion, but it can be affected in some way when you're not having when you're having poorly controlled cholesterol issues, as can kidney disease. Again, this is all part of the whole hormonal family discussion too, right? We're all interrelated in our body systems. Everything kind of relies on something else. When one thing gets set off, it could impair another function. Polycystic ovary syndrome could also be correlated to cholesterol and heart-related diseases as well. If you are a female body, then you have ovaries, and there could be issues with, as you can see here, the way that that word is broken down, polycystic, meaning that there's many cysts that form. It can cause some insulin disruptions and again, increase the chances or vice versa. So it can be affected by your cholesterol issues that can impair things, cause hormonal issues, reproductive things, erratic periods, menses, etc. And then the last thing on that list as well, hypothyroidism thyroidism. So that is when if you were in the January webinar, we talked about thyroid health. That was the whole discussion. That's when you have a low level of thyroid hormone that is created in this thyroid gland up in your neck here. So again, this is all related to a variety of different systems that are controlled by different kinds of hormones. And here we have the common conditions that can appear. So even though you might think, what does this have to do with cholesterol? It can. A lot of these things are kind of interrelated in that way. So here's what you're going to keep an eye out for. Based on current research, the medical community, and sometimes we do see things like this change as we gather more information and we get more information from, hospitals and individuals, et cetera. But as it stands right now, we have what is known as your blood lipid panel. So this is the test that you're going to take when you get blood drawn. It's usually on a basic metabolic panel. So when you go to get your physical exam, you're usually going to see cholesterol and those, like as a family, right? Total cholesterol and those little other things that I mentioned earlier with the HDLs and LDLs on there too. So here you can see a breakdown from bottom to top, right? Heart healthy, if your cholesterol is under 200, not a big deal. Seems like you're in the good zone. If your LDL cholesterol, we mentioned before the LDL and the HDL, remember LDL lousy or the bad stuff and HDL the happy or the good stuff. If your LDL is under 100, because we don't want too much of that going on, and if your HDL is 60 or higher, then you're in the green zone. It's all good. In that yellow section in the middle part there, this is where you're more borderline. Potentially, this is a time where you and your doctor would be talking about what changes could you make. You might be put on medicines, which we'll talk about in a second. And you might be asked to come back in like 3 months, right? They might say, come back in 3 months instead of a year. Let's just make sure you're not getting worse and you're not progressing into that dangerous level that you see there on the top. 240 and higher for your total cholesterol, or in the categories of LDL and HDL in that red zone, you want to stay 160 and higher would put you in the dangerous level. When we said we don't want too much of the LDL, that would be considered the dangerous level. And if you're skewing under 40 or under 50 in the HDL, that means you don't have enough of that good cholesterol going on in your blood, in your body. And so that could also be in the danger zone, putting you more at risk for heart disease, heart conditions, all the stuff that I just shared with you on that previous page. But again, as I said, sometimes your body's just manufacturing cholesterol at high level. I have that. I have genetic predisposition, what is known as familial hypercholesterolemia, right? So that thing I mentioned in that previous slide, that my liver just naturally produces this. So what you're going to see coming up in the slides about how I could possibly, somebody like me could manage these things. I have to be a little bit more conscientious of a variety of my lifestyle factors, but also food plays a role in that too, because my body's already making enough and beyond in that cholesterol level. In the LDL and HDL, those are a little bit trickier because sometimes, again, you could be doing everything quote unquote right, and your body is still kind of fighting against you. So it's possible that your doctor and you would have these conversations and talk about maybe putting you on medicine, either short or long term. And of course, anytime you go on any kind of medication, I always encourage you to speak with your doctor about possible side effects, whether or not the dosages can be lowered as you continue to modify some of your lifestyle modifications, habits, and so on, and seeing if that makes a difference, or if you need to be on something long term, because this is your heart, my friends. You have to be able to have a heart in order to function in life. All right, let's talk about triglycerides. So we also have triglycerides as part of the cholesterol family. Molecularly speaking, it looks a little bit different than the things that I just explained to you, but the higher your TGs, your triglycerides are, the higher risk you have of heart disease. So here again, in your cholesterol blood test, when you go to the doctor and you see the total cholesterol, usually underneath it, you'll see LDL, HDL, and TG. So TG is going to be the triglycerides. So here too, I'll show you in a second about what that range is, the numbers that you're looking for there. It is another type of fat or lipid that's moving around through your body. It is part of the cholesterol family. But in this case, there's actually a lot of different influences here that are not directly related to fat. It's actually part of storing what is known as like unused calories. And so if you're, over consuming calories in general, like you're eating a lot of food and not necessarily burning it off, that is unused calories. That's stored energy that your body doesn't know what to do with. So it's sticking it in these triglycerides. And the more triglycerides you have, the higher risk of heart disease you have. So it's helpful to be efficient when you're eating and utilizing that energy. And it also is directly related to higher carbohydrate or refined carbohydrate intake. So things like alcohol, right? This is technically part of the carbohydrate family. Alcohol is considered like an empty calorie, as they say. There are calories in it, but your body doesn't know what to do with it. So it's storing something that is unused. Or things like candy and sugary items as well. So here is where your body converts that. It converts those calories coming from those items like carbohydrates that you're not using, stores them in these triglycerides, and ends up packaging them and making it putting you at a higher risk for your heart disease. They obviously energy. So when we talk about providing your body with energy, yes, these are things that you can burn off at some point and it can be utilized as energy or calories that are stored. But if you're unusing them, if you're not utilizing them, they package and they store away. And it is greatly influenced by lifestyle habits. Just got done saying all the things: sleep, smoke, et cetera, moving around, right? Getting that body oxygenated, that blood flowing, everything that you usually think of when you think of quote unquote healthy lifestyle habits plays a huge role in helping you manage your triglycerides. So in the case of TGs, again, right, it's going to be part of your total cholesterol family in your blood test. If you see it separated out, these are ones that you don't want to have too many of. So less than 150, you're in a good zone. That borderline area of 150 to 199, again, could be the time where your doctor and you are saying, let's keep an eye on this. Maybe you come back in 3 months, maybe make some lifestyle modifications, eat a little bit more efficiently, like try to make sure that you're managing your energy and your physical activity and you're using what you have in your stores and what your body is eating and taking in, being a little bit mindful not to eat too excessively of some of the other more indulgent types of foods. And then if you're in the higher than 200 level, that is considered the danger zone. So we want to make sure that we stay less than that to lower our risk of heart disease. All right, so we just got done talking about modifying your lifestyle habits in some way. Sometimes easier said than done, right? Whenever we bring these things up, it's a matter of what makes most sense. Are we going to obsess over certain things? Absolutely not. You want to live a life and have it be quality. So I wouldn't necessarily advise everybody to strip away everything and try to be as perfect as possible because that is not realistic and that is not sustainable. But little things, right? Take a look at the broader range of things that you're doing in your life: sleeping, smoking, stress, food, movement, alcohol consumption. What are some things that you think you can modify, adjust, limit, avoid if you need to, if you think it's going to, if you're in that danger zone to put you more at risk? If you and your doctor discuss, you could be put on medications. These are known as statins or inhibitors. So what they do is they block that process of how your body makes cholesterol. And there could be some side effects in there. Usually we see some like gastrointestinal problems come up, but again, you want to discuss with your doctor or your pharmacist when you're picking up your prescription. What is it that I should be on the lookout for? How rare are these side effects or how prevalent are these side effects? And then discussing with your doctor, is this something that I have to be on long term? Because of course, everything comes with some sort of consequence when you're taking medications, either in your kidneys or your liver kind of getting damaged in long-term use. So again, if that's something that you and your doctor can keep an eye on, that if you're modifying some things and they think they can reduce your dosage of your medication or completely take you off of it, that's fine. Obviously, make sure you speak with your healthcare professional before doing anything like that on your own. So those are really the two recommendations. If you're dealing with high cholesterol, it could be a matter of adjusting your lifestyle or the medication stuff. So let's talk about, where does cholesterol come from? I just mentioned on the left-hand side, that's your liver. If you've never seen what a liver looks like, it's located kind of beneath your rib cage on your right-hand side, and it does span across pretty much like half of your body across there. And so one of the things that your liver does is create a source of cholesterol. I mentioned, right? It's called a non-essential nutrient, meaning that you don't need to get it from food, but so many of the foods that we do eat contain cholesterol in it. On the top there, those pictures that you see there, those I guess I would probably term as like more wholer type of foods, the animal products, the dairy products, maybe, minimally processed like cheese and dairy technically is a processed food, meat, etc. Even fish, those contain cholesterol. On the bottom, you have some of the more highly processed foods, so things like cakes and pastries, all the fun stuff, your plate of cold cuts, etc. So again, containing cholesterol. All right, I'm going to give you a little pop quiz. You can either put this in the chat or think to yourself what you've just learned. Which do you think contains more cholesterol? We talk a lot about high fat foods sometimes, and both of these contain fat. But which one do you think contains more cholesterol? Would it be the avocado or the egg? If you want to put that in the chat, please do. Or if you just want to think to yourself, if you're shy or don't have a chance to type in the chat, that's okay. I'm going to share with you a second the answer. So which has more cholesterol in it, the avocado or the egg? I'll take a sip while I'm waiting. All right, my friends, this is actually a trick question. If you've had me before, or if you've attended any of my other webinars, it's a trick question. We just got done saying that only animal products, animal organisms contain cholesterol. So the fact that an avocado is not a living, breathing animal organism, it's not going to contain any cholesterol, it has no cholesterol in it. It does have a good amount of fat, but it actually contains the unsaturated healthy fat. Whereas the egg, I'm not anti-egg, by the way, the egg contains a variety of different kinds of fat. The cholesterol is actually contained in the yolk. So that's where the more prevalent concentration of cholesterol is going to be, is in that yellow part. That's what makes it taste so good, right? That nice buttery feel that you get when you're making eggs. The white of the egg is where the concentration of protein is going to be. So here's an example of something that I have to do if I'm dealing with my high cholesterol condition, my diagnosis. And my liver's already working overtime and making cholesterol for me. When it comes to food, I have to be a little bit more conscientious about taking in cholesterol. And I'll explain a little bit too in a second. I think I'm going to share within a second. What we've come to see, as you saw before in that slide, the more like dietary cholesterol, the things that come from more wholer foods are less problematic than the more saturated fats and those highly processed foods and the refined foods that I would be eating in like the indulgent, fried chicken, French fries, pastries, etc., cookies, those types of fats and that kind of cholesterol is a little bit more damaging to my body than something like an egg. So I'm not anti-egg. I would rather you eat eggs than maybe some of the other stuff in abundance. But my point was, what I would sometimes do is I'll eat one whole egg and then well, I usually have like a container of egg whites. I don't want to waste the whole yolk. So I usually have a container of egg whites. So I'll give myself one whole cracked egg and then I'll use a serving of the egg whites. So that's a workaround, right? I'm still able to enjoy the flavor of it. There is a lot of nutritional value in the yolk of an egg in this particular example here. So I don't want to get rid of it entirely, but I do want to make sure that I'm monitoring my cholesterol intake when it comes to foods. And so that's something that I would maybe sacrifice from time to time, right? So maybe over the course of a week, I have eggs 2 or 3 times a week. Maybe one day I do 2 whole eggs, another day I do 1 egg and an egg white, and another day I just do 2 egg whites. All right, so let's talk about the role of fiber. So here's something else that in helping you, right, the treatment of your lifestyle modifications, this is bringing in fiber. So here is where we're sharing guidance as far as food is concerned. A lot of us just don't get enough over the course of the day, where fiber is contained in plants. That's it. Yes, they're plant-based produce items, very, very rich in fibrous amounts of food. So amount of fiber, which I'll in the coming slide, I'll show you some of the comparisons as to how much is in certain things. But the role that it plays, the role that fiber plays with helping you bring down that cholesterol is what you see there. That fiber, there's a couple of different forms of fiber, but the viscous soluble fiber is what we're talking about in the plant cell walls. It is not digestible by our bodies. We eat the food, it breaks up, it goes and does what it needs to do, and then the fiber content separates out and ends up excreting, right? So we're not using this. This is what comes out the other end. But on its way through our body, it actually helps absorb some of the water and it swells up to kind of like act like a sponge. And in doing so, it kind of scrubs through our blood vessels and our tracts and all the other places that things are going, and it helps to lower I was gonna say it says unhealthy cholesterol, but really let's say like more like the excess cholesterol could help with that. So how we get fiber-rich foods, as you can see here, honestly, anything that is considered plant food. So a grain, a bean, leafy greens, fruits and vegetables, anything there. There is a spectrum. So gram for gram, you will see that things like beans and maybe nuts and avocado actually have a little bit more fiber content than something like a piece of lettuce or an apple does. So again, when you're looking at your food, it's about diversifying your diet, making sure you have a little bit of everything. So I'm not a huge fruit fan. Like once in a while, we'll have like oranges or apples in here, but I don't include fruits every single day of my life. I do berries from time to time, but I usually probably go more with like the beans and the leafy greens and that sort of thing. And also oats. So whole grains. So this is also where fiber is coming from, that outer skin. So if you're eating foods that have a peel, an edible peel, a skin around them, if you leave that on, like a potato, an apple, brown rice, whole grain types of items, then you're going to have more fiber in there. I'll share with you in a second what the recommendation is, as you can see on here. Again, we don't probably get enough of this in our daily diet. As the like Americans are concerned, we run a little bit low on this. So we're going to go into the nutrition facts label. If you're purchasing foods with a label on them, so these are processed foods, right? Nothing that you're getting whole, but I'll share a little bit more about things that don't have labels in a second. You're going to try to stay within the ranges you had here. So these are kind of like your recommendations. Try to stick to under 20 total grams of saturated fat over the course of a day. Try to stick to under 300 milligrams of cholesterol for the day. For fiber, I mean, the more the better, but we'll talk a little bit about how that could be an issue if you get too much fiber in your body, but about 25 to 30 grams a day is what we usually recommend. And added sugars, right? Because we just got done saying before, triglycerides are unused calories. We usually see that sometimes if people are eating in excess of sugary types of foods or highly processed foods. So you're going to try to stay under 30 grams a day. Now, the the challenge here is that if you're not tracking and logging your food, which I don't really recommend everybody does, that can become very time consuming, a little bit overwhelming. Maybe some people might get obsessed over this too. I don't want it to trigger anybody that you have to weigh and measure your food, but I just want you to take a look at what you're eating. So maybe for like, a week or so, if you feel like documenting some things just to kind of collect data, how much is it that I'm eating over the course of a week? What is it that what's missing from my diet? What do I need to add in? Or what do I want to be a little bit mindful of, especially if I'm dealing with being at risk for a chronic condition or already having an illness that I'm diagnosed with? Then you might want to just keep track of some things. So this way, again, you're just collecting data for a little bit of time and you can see where you can maybe make some modifications accordingly. So how you are looking at the nutrition facts label from top to bottom here. This is the new version that came out a couple of years ago. Not me, the United States government. They revised the way that we view and some of the information listed, how it appears on the nutrition facts label. So you're looking at, in this case, whatever this particular food item is, this is 8 servings per container. The container is maybe packaged out into 8 different things. A part of me feels like this might be, I want to say like sweetened oatmeal, like oatmeal packets that you could eat, right? Like you break open a pack and you make in the morning. So that's what I'm pretending it is. So whatever the little packets are is a 2/3 of a cup serving size, and that contains 230 calories. And then all of those, what are known as macro nutrients, are in that top section there. And the micronutrients, the vitamins and minerals, are down at the bottom. So in this particular case, if you're looking for the saturated fat, so the stuff that could potentially clog your arteries, and the cholesterol, you're looking right here in that top section. So again, you have the family, the larger total fat, and fat is going to be broken out into a variety of different things which are not listed on this label. But we are pulling aside and we're noticing, okay, so sat fat is 1 gram, right? I said, what did I say before? Stay under a certain 20 grams or something like that, right? So that's not so bad. 1 gram's not bad, but maybe over the course of the day, you're accumulating quite a lot of saturated fat and you might just want to keep an eye out for that. In the case of what we have in front of us here, 0 milligrams of cholesterol, which is why I'm thinking it's a plant-based food because it doesn't contain any cholesterol. Okay, next up, how do I see where the fiber is? How much fiber is in this particular food item? Fiber is part of the carbohydrate family. Remember, we said it's in the plant walls. So this is plant-based, and that's really the only place it's found. So you have total carbohydrates that are listed at 37 grams of this particular food item. That contains a lot of different things, but we have separated out the fiber in this, and that's 4 grams of fiber. That's actually not so bad. Usually 3 to 5 grams of fiber is pretty spot on if you want to get enough bang for your buck in one particular food item. Again, over the course of the day, we want to make sure we get you up to that 25 to 30 gram region. So if that's something that you're interested in increasing in your diet, you can take a look at the labels, and I'll show you in a second about how to search for food online as well if it has no labels on it. All right, next up, added sugar. So again, here we said we want to kind of limit this. And of course, listen, you have a birthday party to go to, or you feel like having a sweet treat, or you're out for some event, or, a night out with friends, and you're all like taking part in whatever dessert, then don't worry so much about that. This is more along the lines of, like I just said, let's pretend this is a packet of oatmeal. Well, I'm trying to be monitoring my diet. I'm trying to be mindful of what I'm included in my food. So I might opt for no added sugar, which means that it's not naturally found in the food, right? Something like a banana has sugar already that comes with it, but something like this has 10 grams of added sugar. So the manufacturer has actually used table sugar and added it to this particular food item. So if I want to be a little bit mindful of that, I might opt for no added sugar, and I'll go home and I'll doctor it up myself. Maybe I'll add a little bit of sweetener in there, or maybe I'll just get used to eating it plain, or I'll add something else to it like berries or fruit, sliced up bananas, something that's a little bit more natural in its state or wholer in its state, and that can sweeten it up for me. So the added sugars here, we're looking at 10 grams of added sugars. And again, this could add up over the course of the day, depending on what else you're eating. All right, so let's take a look of food without labels. You are in the future, right? We have internet, we have technology. So if you're eating something that you're buying as a whole food that does not have a package around it, and you're not sure exactly what the content of the nutritional makeup of it is, you can, especially right now, Google, if you type in avocado fiber content, Google will pull up like its version of a nutrition fact label, which I think is kind of cool. So here we have here on the top level, I'm just comparing for you different categories of foods and different categories of the nutrients that are in them that we just discussed. So saturated fat slash cholesterol found in avocado there. Actually, I made a mistake. That should be 3 grams of saturated fat in an avocado, right? Avocados contain saturated fat, but doesn't contain as much saturated fat as a beef patty or a burger. So that's ground meat in the middle, like a ground meat beef patty or a burger. And on the right-hand side, we just talked a little bit before about the egg. So eggs contain 2 grams of saturated fat. So here, there's less saturated fat in an egg than there is in an avocado, but avocado has no cholesterol, a lot more ratio-wise, we don't have it listed here, but a lot more of the unsaturated fat or the healthy fats, the good heart healthy fats. Whereas in the middle, that burger, again, this is an animal product. It has 78 milligrams of cholesterol, and we just saw that the egg has 187 milligrams of cholesterol. So, right, again, just, pick and choose things that you are looking to try to modify. Keep in mind over the course of your eating, meal planning, whatever choices you're making, if it helps you to maybe write some of these things down, I would, again, probably just say for 1 week, that's it, just to kind of get an idea of how much is in things so you can collect some data and then make an informed decision. But I wouldn't obsess too much about this. The more you diversify your diet, the more different kinds of foods you have, you should be okay. You should be okay. I mean, I don't know you well enough to say that, but I can just generally say if you're diversifying your diet, you're not eating, 6 eggs every single day of the week, you should be okay with mixing it up a little bit and getting just kind of like, what you need and not too much extra. All right, let's go to the next level. So we have something like apples with the skin on, 5 grams of fiber. Avocado, you're going to peel the skin off. You really shouldn't eat the avocado skin. I don't think it tastes very good. It's very tough. But when you scoop out that avocado flesh on the inside, it's 13 grams of fiber. So that's a very fibrous food. In comparison to a serving size of beans, so whether this is dried beans or canned beans, not really, doesn't really matter. But the point is there's about 30 grams of fiber in a serving of beans. So if all you're doing is just eating beans every other day, you're going to hit your recommended number as far as fiber is concerned. If you're not a bean fan, if you don't love, the bloating it gives you, or if you don't include it in a variety of your meals, you can mix and match some stuff, right? A little bit of everything. Eat a half of avocado today, eat a half of a serving of beans tomorrow, throw in some fruits and vegetables, etc., and you should be able to meet your requirement, your recommended daily requirement of fiber. And at the very bottom, so it's not added sugar, but I wanted just to show you the sugar content of foods. So the more savory something is, the less, and also the less starchy something is, the less amount of naturally occurring sugars are going to be in this particular food item. So obviously, I think it makes sense on the bottom line there. Something like an avocado, barely any sugar in it, naturally occurring sugar. The beans, 4 grams of naturally occurring sugar. Again, it's a little starchier too. You can, right? It's a little like a potato almost too. Like you can feel that texture of it. That's going to be sugar molecules at work versus 19 grams of sugar in an apple. So that can seem quite high if you're managing your sugar intake, even though it's a whole food and it's good for you. That might be something you might want to maybe split in half and maybe eat half of it with nuts or peanut butter, and then the other half with it later on with, nuts and peanut butter or cheese or something later on to kind of offset that. So if you're dealing with blood sugar issues like diabetes, etc., it could be a little bit more well balanced. If you're eating just an apple on its own, that could feel like a bit of a shock to the system if you're eating on an empty stomach. So again, just some guidance there if you're trying to be mindful of how much naturally containing sugar some foods might have. So these are foods without labels. Okay, now I want to ask you to please make sure that you're keeping up with preventative care. If you can, if you have health insurance, if you have access to doctors, make sure that you're getting tested every year. If you are dealing with an issue like heart disease, maybe high cholesterol too, as I mentioned before, kidney issues, diabetes, your doctor will probably ask you either your primary care or you might see a specialist. They might ask you to come in every 3 to 6 months instead because your blood levels change. That's just how your body works. Every 3 to 4 months, your blood cells kind of regenerate, renew, and they can have a big difference from every 3 months, from check to check. So if you're fine, if everything's good, you're not in that borderline area, getting checked once a year is probably enough. If you do have issues, you and your doctor can have a discussion that you might want to go in a little bit sooner. Again, depends on what your insurance covers, your copay, whatever you can afford to go see them. Keep in mind, as it says on the bottom there, that some of these symptoms are going to be undetectable. Blood pressure, you might know. You might start feeling your heart flutter. You might start getting dry mouth with things. Like your body could show you the effects of high blood pressure, but sometimes it's the silent killer, as they say. You're walking around and boom, that's it. Your heart goes. Cholesterol levels, you might not know that your body's producing a high level of cholesterol or that whatever you're eating is getting caught up in an excess amount in your body. So your body might not tell you that until it's too late, where, there's a heart attack issue or a brain blockage and a stroke happens. Diabetes, we have some symptoms of diabetes, some issues with like, needing to drink a lot of water or excessive urination. Sometimes there's certain symptoms that do show up if you have diagnosed diabetes or are pre-diabetic. So there could be some symptoms there, but sometimes you don't know if your blood sugar is super high or super low. So diabetes blood glucose is usually in your annual test, but your doctor might also send you home with a finger stick or a glucose monitor so that you can check your blood sugar over the course of the day if you are at risk for something or if you have been diagnosed with prediabetes or type 2. Of course, if you're type 1, that would be something lifelong. That's an autoimmune condition. You will definitely be checking your blood sugar for that. But the point is it helps prevention. If you're not big on going to see the doctor, if you hate getting stuck with needles, I get it. but it's better to know than not know, I think, so that you can make the proper informed decisions on how you can manage that and make sure that you're not put at risk in the future. All right, my friends, we are going to start wrapping up this discussion. I don't think anybody's, I'm looking at the chat right now. I don't think anybody's chimed in yet. If you want to share, you don't have to because this is a private conversation that you might want to have with yourself or your loved ones. But what are some of the things that you think you can start doing to make sure that you're prioritizing your heart health and specifically cholesterol? So if you are dealing with already know that like me, like you have high cholesterol to begin with, are there some modifications? Can you maybe subtract a little bit of the animal products that are high in cholesterol? Can you maybe keep track on a food log for a week just to see where you might have to make some modifications? Can you increase your fiber intake? Can you stop smoking? Can you adjust your sleep habits? Can you move around a little bit more physically, be more physically active if you are able to do so, if you've gotten clearance and you're able to do so? Think of these small little things that you can maybe create goals for yourself, habits that form over the course of time, very small, realistic changes that you can make that do add up in helping you hopefully improve your conditions or your health overall over the course of time. So let me take a second. I'll drink another sip of water if anybody wants to chime in the chat of what you think you might do next if you feel like sharing. If you don't, that's okay. I have been able to so far not go on any medicine. I don't love meds, but I also am not anti-meds. I do believe that if there's a reason for it, to save you from dying or to making, to reduce anything from getting worse, then by all means, I'm comfortable with it. But if I can prolong it and see if I can make some more lifestyle related adjustments to my diet, my whatever, my physical activity, etc. My doctor and I have many discussions about that, and I try to manage that as best as I can. All right, so I'll open it up for any questions that you might have. Seems to be a quiet group here today, which is okay. And I'll let that I'll let that chat box remain open. In the meantime, I'm going to share with you what's up for next month. So next month is dietitian's favorite month. March is National Nutrition Month. Every year there's a campaign by the Academy of Nutrition and Dietetics, which is a membership group that oversees the profession of the dietitians, and they have a theme. So this theme, they're doing what's called Beyond the Table, which has to do with like sustainability measures and farm to fork. So we're going to talk a little bit about food waste and knowing where some of your food comes from and what the difference is between locally grown and organic foods and seasonal produce. So we're going to share with you some of the insights there to help you understand a little bit more about the role that you play and the role that your food plays as well beyond the table in the environmental setting. So that will be on Tuesday, March 5th from 1 to 2 p.m. Eastern time. When we're done with this conversation today, like I said, I'll email everyone who has registered with the link for the recording of this, as well as the survey form, and then I'll also keep you posted as to what's coming up next. I always like to pitch a few things that I've been working on. I think I talked about this for years on end, and I'm still working on these things. Obviously, I love doing things for free for anybody who wants it, so I'm happy to put out educational, informational stuff both here in these webinars, on my social media platforms, on my YouTube channel. All that stuff is free. But I am also working on these chronic condition online courses. $28 for 28 days is how I'm pitching it. So it's 4 weeks. Every week you get a different module, a lesson, a downloadable thing, some information. And it's kind of like if you've been diagnosed with a particular condition, here's what you need to know about it. Here's what you need to do about it. And here's some information what you might need to take with you when you go to the doctors. Because not everybody is 100% aware of or gets explained by their healthcare professionals of what their condition or their disease state is. And so I'm going to try to help clarify that in these online courses, which I believe is hopefully a good affordable price. And you can always upgrade these things and have a conversation with me as well. If you are a dietetic intern, a student, nutrition student, newly credentialed RDM, this is actually happening kind of right now. I'm always willing to help people in furthering their careers. So I am doing some business and career coaching for dietetic interns. There's a lot of stuff we just don't learn about when we're in school. It's totally understandable. Our curriculum takes us through a lot of clinical stuff, but not a lot of like what I need to know about the counseling world or how to better position myself to get a job. And so I'm putting together some of this guidance as well. And this is, I think, going to be running on a membership fee. So that means you pay a price and then you kind of get like, whatever, 45-minute session with me once a week or twice a week, or twice a month, etc. I'm still working on the details of these things. And then, of course, last but not least, you can find me across like all the social media platforms. I'm Dish with Dina. I do have a YouTube channel. Anytime you find me, if you think some of the information is really useful, the podcast that I have as well, the YouTube channel, the Instagram pages, please share it with others. It's it's kind of silly when I say things like and follow and subscribe, but it really, especially with the case that a lot of us are seeing right now in social media, where these algorithms are just like not letting us have a reach. I have like almost 3,000 followers and I get maybe 4 people viewing some things. So it helps to have you kind of be actively engaged or share or leave a review or whatever it is that you can do when it comes to, being able to interact and engage with me on social media. So I very much look forward to seeing all of you again in one of our next discussions. Of course, if there's anything else that you wanted to share or throw into the chat, please let me know. Otherwise, that concludes today's discussion. And like I said, I hope to see you again next month when we talk about Beyond the Table, the National Nutrition Month. Thanks so much, everybody.